Itina Minista Muviani wa Uiiti Aden Duale Iyoo Kuweta Mbee wa Maovisa ngilimo Nzama Uiiti ma Universal Health Coverage UHC yuta Mekwithiwa Mayiivwa Silikali sia Mitiuuko Ungu Muvia wa Uiiti Ngwatanio ya Mangavana Matongoew'e ni Mweene Kivila wa Nzama ya Uiiti Muthomi Njuki Nimaleana na Itambya Muthomi ainena na andiki Maovisa eyasikana Silikali ya kati na ile ya Mitiuuko selete kuthukuma mwamba kwena na katiba kandi ya Kenya inditi Silikali ya kumya moloto kwa Silikali sia county Mweene Kivila yasikana Nzama ndinakonwa ndine wa Itambya ya Kuleana kwambe ya kuiba Maovisa ama Uiiti Mbee wangili monza lina musangi mawatumbani senga.
Mweene Kivila uwa kamiti ya Uiiti Ngwatanio ya Mangavana Muthomi Njuki onina na andiki Maovisa nuweti Ngwatanio ndikwitikilana na Uneeni wa Minista Muviani wa Uiiti Aden Duale Iyoo utaundu kuelezea.
The statement that was issued by the Cabinet Secretary, while acknowledging the ongoing collaboration between the two levels of government in addressing the management of UHC staff, the Council of Governors wishes to clarify that it does not concur with the Minister of Health position expressed in the press statement yesterday. The press contradicts the previously agreed position between the national government and the Council of Governors who represent the county governments.
Mweene Kivila weta Uneeni wa Minista Duale tuvetukanu na wiwano wa serikali ya katina ila sia Mitiuuko maundu makonete Maovisa ma Uiiti.
On the transfer of universal health coverage staff, it was agreed that the Ministry of Health would allocate adequate resources as per the approved SRC salaries scale before the transfer of the payroll to the county governments. Since the contracts are still valid, the decision to transfer the staff at this time is premature and untimely. Number two, on verification of the UHC staff, the report on the verification exercise of the UHC staff has not been validated and officially shared, and therefore the process of transfer that the ministry is proposing is not agreed upon. Thirdly, on payment of gratuity for UHC staff, the UHC staff currently are engaged on contractual terms and are entitled to gratuity. The Minister of Health should therefore settle all the gratuity payments for UHC staff before the transition to county governments. The Council reiterates its earlier commitment to absorb the verified UHC staff and facilitate their salaries in line with the approved SRC salary scales once the allocation of the resources have been disbursed to the counties as well as the gratuity obligations have been honored.
Nivala Ngwatanio ya Mangavana yendekethia Muvia wa Uiiti kwatia Mayiivwa na lometikilanie no kenda kuikithia Maovisa ma Uiiti ni mathukuma kwa
Ladies and gentlemen, the Council of Governors recommends that the national government, through the Ministry of Health, allocates and channels the attendant resources to county governments through DORA to facilitate the absorption of UHC staff as per the county HR policy, failure to which the absorption of UHC staff will be unattainable. The Constitution provides that both the levels of government should relate on the basis of consultation as opposed to directive. The Council of Governors reaffirms its commitment to working collaboratively with the Ministry of Health to resolve all the matters related to UHC staff and the management of the same in the spirit of partnership and in the best interest of strengthening health services delivery across all the counties.
Good report of Lingua Movo Nelina Mosangi.